All right, let's get right into it. The human abdomen isn't just a basic body part. It is, quite literally, a clinical crime scene just packed with hidden physiological stories. But here's the thing. To crack the case, you absolutely cannot just guess. We aren't just going to look at flat images from a textbook today. We are talking about reading a live 3D system. You need a highly structured, systematic approach known in the medical world as IPAP. Welcome to this explainer, where we're going to master this exact investigative technique so you can learn how to read the body's secret signals.
So here is our roadmap for the explainer. We'll start with setup and anatomy, move to visual clues with inspection, explore the art of touch with palpation, map things out with percussion, and finally listen in during auscultation. Starting off with Section 1, Setup and Abdominal Anatomy. Now, you can't solve a puzzle if the board is a mess, right? Every great examination starts exactly here, with communication. Bedside manner and patient consent are just paramount. You physically cannot examine a tense patient. You want them completely comfortable, lying flat on their back in a supine position. And ideally, you want their knees flexed. Bending the knees actually loosens and relaxes all those abdominal muscles, making your job way easier. Okay, think about how doctors actually map this area out. They don't just look at one giant surface. They mentally divide the abdomen into 9 distinct regions, kind of like a tic-tac-toe board, using 2 horizontal and 2 vertical imaginary lines. By breaking it down into these specific zones, like the epigastrium at the top center or the right and left iliac regions down at the bottom, practitioners can precisely pinpoint which underlying organ might actually be the culprit.
Moving right along to Section 2, Inspection and Visual Cues.
So this is the I in the IPPA framework. And the absolute most crucial point here is that we must look very closely before laying a single hand on the patient. The very first visual check is the baseline contour. Basically, the overall shape. Is it flat, which is normal? Is it scaphoid, meaning deeply sunken in? That's a huge red flag that could indicate severe weight loss or malnutrition. Or is it protuberant, meaning it's visibly bulging outward? Now, if that abdomen is protuberant, we use a classic medical mnemonic to just quickly run through the usual suspects. It's called the 5 Fs. We ask ourselves, okay, is this distension caused by fat? Fluid, like in a condition called ascites? Feces from an intestinal obstruction? A fetus from pregnancy? Or flatus, which is just excess trapped gas? It's a really brilliant way to see how a simple visual assessment immediately structures our clinical logic. But beyond the overall shape, we're hunting for specific surface clues. An everted or outward pushed umbilicus, that often points to heavy fluid buildup inside. And then there's caput medusae. These are dilated, tortuous veins radiating from the navel that literally look like jellyfish tentacles. It's a major warning sign for portal vein obstruction in the liver. We're also looking for pigmentation lines, stretch marks, which are known as striae, or even visible peristalsis. That's when you can actually see waves of muscle contraction rippling right under the skin because the body is fighting a literal intestinal blockage.
Which brings us to Section 3, Palpation, the art of touch.
A really quick pro tip before we press down: warm hands are an absolute must. Cold hands cause the patient's muscles to tense right up. Now, palpation happens in 2 distinct phases. First is superficial palpation. This involves a light, gentle dipping motion. We're just testing the surface for temperature, tenderness, and muscle guarding. Guarding is when the stomach muscles involuntarily tense up to protect inflamed organs underneath. Once that superficial check is clear, we move to deep palpation. This uses firm downward pressure to actually locate and feel the margins of those internal organs, like the liver, spleen, and kidneys.
But that naturally brings up a really fascinating mechanical question, doesn't it? How in the world do we actually feel an organ that is tucked way up under the rib cage, like the liver? Well, it requires this perfectly synchronized dance between your hands and the patient's breathing. You don't just jab at the ribs, you actually start low, down in the right iliac fossa at the bottom right of the abdomen. Then you ask the patient to take a deep breath in. As their lungs fill up with air, the diaphragm actively pushes the liver down. Right in that exact moment, you push your fingers gently inward and upward. If the liver is enlarged, you'll literally feel its firm bottom edge descend and tap right against the side of your index finger. It's pretty amazing. Other hidden organs, they need totally different techniques. For the spleen, you sweep diagonally across the belly from the lower right all the way up toward the left rib cage. And keep in mind, a healthy spleen is normally not palpable at all. You only feel it if it's enlarged from disease. Kidneys require a 2-handed bimanual trapping technique. You place one hand firmly behind the patient's back, one in front, and apply pressure to feel the kidney bounce back and forth between your hands. We call that ballottement.
Section 4. Percussion, mapping with sound. This is where you literally use your own fingers like a human sonar device. By placing one finger flat on the abdomen and striking it sharply with your other middle finger, you create and listen for two main types of sounds. Tympanic sounds are hollow, drum-like notes. You're going to hear these over airfield structures like the stomach and healthy intestines. Dull sounds are totally different. They're flat, thud-like notes. You hear these when you tap over solid organs like the liver, or, crucially, over areas that are filled with fluid. Finding that dull thud where it absolutely shouldn't be is vital. Why? Because it helps us diagnose a condition called ascites. This is the abnormal accumulation of free fluid right inside the peritoneal cavity of the abdomen, and it's very often associated with severe liver disease. So to confirm ascites, doctors use this incredibly clever step-by-step test called shifting dullness. You percuss outward from the navel until that hollow tympanic sound suddenly turns into a flat, dull thud. You keep your finger right on that exact boundary line. Then you ask the patient to roll over onto their side. You wait 1 full minute, just letting gravity pull that internal fluid downward. Finally, you tap that exact same spot again. If the sound has shifted back to hollow, boom, it proves the fluid moved. Gravity literally just did the diagnostic work for you. Now, for extreme cases where there are at least 2 liters of free fluid in there, we test for what's called a fluid thrill. You have the patient place the side of their hand firmly right down the midline of their own belly. This is super important because it stops vibrations from just traveling through the surface fat. Then you place your hand flat against the patient's left side. Finally, you sharply flick their right side with your other hand. If there is massive fluid buildup, you will physically feel a distinct water wave ripple all the way across the abdomen and smack into your left hand.
And finally, Section 5, auscultation, listening within.
This is the one and only phase where the stethoscope finally makes its appearance. The goal here is simple. We want to hear a gurgle. Normal, bubbling bowel sounds mean that the digestive tract is moving and doing its job. But if you listen and hear a totally silent abdomen, no way, that is a massive red flag. Absolute silence warns of a highly dangerous condition called paralytic ileus, which basically means the intestines have completely stopped moving.
And that wraps up our journey through the IPPA framework. By mastering this sequential art of inspection, palpation, percussion, and auscultation, what hidden physiological stories can you uncover at the bedside? I really hope this explainer has shown you that with a structured, logical approach, the body is always speaking to us. We just have to know how to look, touch, tap, and listen. Thanks so much for joining me, and keep learning.